क्या स्टडी वीजा पर यूके आना चाहते हैं? यूके वर्सिटी दे रहा है आपको सुनहरी मौका। अब तक 5,000 स्टूडेंट्स यूके वर्सिटी से पढ़ चुके हैं। आज ही अपना एडमिशन करवाएं और जानकारी के लिए हमारी वेबसाइट विजिट करें या व्हाट्सएप पे कांटेक्ट करें।
क्या आप स्टडी वीजा पर यूके आना चाहते हैं? यूके वर्सिटी दे रहा है आपको सुनहरी मौका। अब तक 5,000 स्टूडेंट्स अपनी तालीम मुकम्मल कर चुके हैं। आज ही अपना एडमिशन करवाइए। मजीद मालूमात
Hi, good morning, Susan. Hi, good morning.
Morning.
Just giving it a couple of seconds for others to join as well. I think, not sure in terms of whether it's the meeting code or, if we are not getting used to the time, but just give it a couple more seconds. I've got a few which have joined, and then we'll get on with the session. And then as they keep joining, that's fine. Any questions that we have from the previous session? Let's do a bit of any previous sessions, any questions from the previous session that we have? Let's do a quick recap for the benefit of everyone. Okay. Okay, that's great. So can you all see my screen now?
Yes.
Right, okay, good stuff.
Yeah.
So, what I will do is let's do a quick recap of what we discussed last time when we started, this particular unit, which is person-centered approach. So what I would do is just briefly, obviously all sessions are recorded, but I'm going to share a quick few housekeeping tips so that we can, mute our microphones. The first one tends to be, if you're not asking any questions, just mute your microphone so it does away with the background noise. The other bit which I would say is you could use the the chat option, and also unmute your microphone when you want to ask a question. That's absolutely not a problem. The other thing which I would suggest is to also look at revisiting some of the presentation that we've done and the discussion that we've done, with regards to this year when we started the first learning outcome last week. But we'll do a quick recap in any case, and that's something that we do as we go along. So as we have some more learners joining in, hopefully by the time we've done our recap, that would allow us to, nicely progress into learning outcome 2. Now, what we did last time was when we started this person-centered approach unit, we basically looked at, discussing an overview in terms of why this particular concept came about, and why is it very important and fundamental to the National Health Service now with regards to specifically the health and social care sector, within that National Health Service, mental health service, and all these services which, the health secretariat or the health and social care department actually provides in the UK. Now, the main approaches that we look at in terms of why this became important was, if somebody recalls, we discussed the introduction of this concept called the person-centered approach by Carl Rogers, which was an American psychologist. And he, in the late 60s, came up with this concept and idea that the care which is being provided to the individual needs to be centered or tailored to that particular person in order for it to have a meaningful effect, and for the person to be able to get back onto his feet or recover, make the recovery, faster. And then we looked at this concept slowly and gradually being introduced by the Institute of Medicine, by the American Medical Association, and in the late 1990s, this concept came into the NHS, and in the early 2000s, after the Lord Tarzai report, this was incorporated as a part and parcel of all the services which the National Health Service provides. And when the NHS Act of 2010 was introduced, this became a mainstay of how any sort of care in a particular setting. When I say particular setting, what I mean by that is a health and social care setting. Anybody who's undergone operation or an operative procedure. When you look at any sort of setting, which is whether it's in the community, whether it's in the hospital, whether it's at the GP surgery, any such trust which basically delivers national health, comes under the National Health Service and delivers the service free of cost to the members of the public, would need to follow this particular approach. Now, this unit that we started basically is divided into 3 learning outcomes. The first one basically looks at a bit of background, how this approach came about, what are the core principles, and then obviously we looked at a bit of history in terms of how and when this approach, was introduced, and we went into that to understand it with regards to some of the challenges as well, which are faced by people working within this sector when they have to tailor the support or care which is being given to a particular patient. So when we talk about tailoring of support or care which is primarily given to somebody, say at the say old age home or a care home in particular, or say for example if a lady has had is basically going through say giving birth to a child, then how the approach, when we look at maternity approach in terms of the team of triage in terms of nurses basically come together and obviously look at providing you support, guidance, advice, and also there are classes and other sessions which are organized for you and the father to be able to go in and prepare for this particular oncoming arrival. So this particular approach of care, which is primarily looking at respecting individual independence, privacy, it's looking at your own decision making. There is no discrimination whatsoever. And then the support which is provided in terms of making sure that it is provided irrespective of culture, background, diversity. And this particular set of approach typically tends to be what is called the person-centered approach. Now, this is what we've covered in Learning Outcome 1. Now, in Learning Outcome 2, we are going to be taking it further by basically looking at, so let me just press record here, so that we are able to, have it for the benefit of some of the others who would be probably catching up with the session later. So after the discussion of the Learning Outcome 1 and understanding the history or background of where this concept of person-centered approach came from, specifically, the experimentation and the concept and idea coming from Carl Rogers in the US, then being introduced by the Institute of Medicine, and then getting into, the NHS in the early 2000s, Lord Dazai's report, and then finally becoming a part and parcel of the NHS 2000 Act. And that is what is fundamental to delivering care within this sector. Now, we are looking at Learning Outcome 2 today, and the session is primarily to look at focusing on understanding how equality and diversity and discrimination in respect of person-centered approaches can be done away with. So there are 4 assessment criteria that we will be looking at covering. One is the concept of equality, diversity, and discrimination. So we'll look at what do these core terms mean, and obviously how they're related to the person-centered approach. We look at some of the legislation which has been introduced by the government in the UK, which is the Equality and Diversities Act, the Discrimination Act, and how is it relevant to the health and social care context. We'll also look at discussing, the legislation which is focused in and around the equality, diversity, and discrimination, and how this can be promoted within a particular health and social care setup. And then we look at the sources of information which can be used to provide advice and support, and make sure that when we look at any sort of a setup within the health and social care sector, how is it that this information is communicated to the members of public or staff, employees, contractors working within the organization, or working in tandem with the organization providing services as contractors and suppliers. And then the distinction criteria of it primarily focuses on a bit of assessment, which is extending one of the task criteria that we will discuss to say that can you look at how is the effectiveness of basically hinting at how do we look at assessing the effectiveness of these policies and legislation which has been introduced by government over the years, and how does it help in promoting care, or let's say providing care without any discrimination within this particular sector. So in terms of the indicative content, I'll just switch you over to the presentation now. So in terms of the indicative content, we are looking at covering a couple of things with regards to let's say equality and diversity policies. We are looking at discrimination policy. We look at discussing a few legislations which are relevant to this particular field. Let me just switch you over again to the indicative content, just for the purposes of understanding. So Learning Outcome 2 will focus on understanding equality, diversity. We are looking at discrimination, and we'll also be looking at some of the important legislation which are relevant to the health and social care sector. And then the source of information in terms of how these sources, things like flyers, newsletters, websites, policies which are implemented and created within the organization, and how they help in basically the propagation or dissemination of information related to these policies, so that while delivering these services, you and me, when we work within this sector, we need to be making sure that we are not discriminating, we are against any culture, any background. We are making sure that our service is being provided or rendered irrespective of the individual's background. And in this case, how do we look at the the delivery of service by following the policies which have been created within the organization, by looking at equality and diversity and no differentiation whatsoever when delivering this particular service. And some of these tend to be given out or collected in terms of information when we serve out questionnaires to patients. Sometimes when you look at how do we So very briefly, how do we look at getting hold of information about a particular patient who's coming in to basically look at some sort of, let's say, a clinical procedure or a surgery within the hospital? You would normally be serving a patient, admission questionnaire, and that admission questionnaire will capture a lot of details about the background. So demographic details will capture details about the culture, the background, the living habits, and obviously, any other medical or medically diagnosed conditions which the patient has, which will all need to be taken into account. So things like food, let's say, what kind of food that the patient would need or require. Is the patient allergic to any medication or any types of food? In terms of looking at the 6 core principles of person-centered approach, looking at if the person comes from a particular culture, do they have any beliefs or any specific inhibitions or requirements which need to be taken care of. All these are going to be looking at how do we get information when, say, for example, collecting information for a patient or about a patient by using a patient admissions questionnaire. Now, if I switch over to discussing this particular learning outcome, what we want to be then able to do is primarily understand and go into a bit more detail with regards to understanding what the learning outcome 2 essentially means, which is where we will take the help of the presentation slides. So the learning outcome 2 again stands primarily for what we need to be able to cover is understanding equality, diversity, discrimination in relation to person-centered approaches. Now, before I go into some of the details, we will look at discussing a few bits of important terminology. Now, when we look at equality, if you look at the Oxford Dictionary meaning of the word equality, what does the word equality mean? Now, equality means the state of being equal. That means we live in a democratic society, and obviously there are no ways through which we can differentiate or treat people. And what the word equality essentially means is that everybody is equal. And because these services are provided free of cost, there is no charge for this service by the NHS or by the Health and Social Care, Department of Health and Social Care. That is where what we need to be able to look at is that these services need to be ensuring that there is a fair bit of equality and there is no discrimination or no injustice which is rooted out to an individual on the basis of equality, whether it's on the basis of their gender, whether it's on the basis of their background, and everybody is to be treated equally. Now, what do we mean by diversity? When we look at the meaning of diversity, it basically means every individual is unique, which means that because every individual comes with or has unique sets of let's say features or let's put it this way, has differences in terms of their own individual personality. So we should be looking at treating individuals with respect, and that would mean that when we look at individuals coming from different backgrounds, and because of the uniqueness of where they come from in terms of their upbringing, their culture, what we need to be able to do is make sure that we don't take into account any sort of discrimination which can be done on the basis of race, ethnicity, gender, sexual orientation, their social economic status, age, or disabilities or religious beliefs. Now, this in general, when we look at when we look at equating this with the word and the meaning of the word diversity, what we do mean is that we will make sure that that while we deliver the service as an individual within this sector, what we are going to ensure is that there is no set of discrimination that we will do or take into consideration. Let me not use the word discrimination, but what I will say is take into consideration some of these things which will define the individual and his presence or his personality or her personality. Now, if we now throw into the mix the word and the meaning of the word discrimination, what we basically mean when we talk about diversity is the state of being diverse. That means everybody is different, everybody is different because of the qualities and the background and the culture they come from. The moment I talk about discrimination, what I mean when we look at discrimination is that we are looking at not paying any unjust or, let's say, we are not going to be prejudgmental in terms of looking at the individual and then looking at ensuring that the individual is to be given this type of treatment or that type of treatment. So without being unjust and without being prejudicial in terms of treatment from different categories from people when they come in from, especially on the basis of their race, age, sex, and disability, we will not be looking at categorizing them on the basis of this. And as long as we look at not categorizing them on the basis of this, we would say that the services being rendered are being non-discriminatory. So in the other aspect, an example of discrimination will be when you tell somebody between a difference between a fine wine and a cheap wine. So if somebody says that I had this, and then you say, oh, no, that is too cheap, and what you should be having is this, or getting this, I had this. This is a way of highlighting discrimination. So when we teach, say, for example, deliver health and social care services, we have to be not taking into account race, age, sex, or disability of the individual. That would mean that we are not discriminating while delivering some of these, basic services to a patient or to a member of the public. Now, when we look at sources of information, how do we look at sources of information? One of the other aspects that we need to look at in the learning outcome as a whole is that how do we get hold of information about the patient or about the person or the individual that is going to undergo some sort of, let's say, will require some sort of care. Let's not say procedure, but says that requires some sort of care. Now, this information could come across from patient information record, PIR, which is when you register with the surgery. If you visualize and put on your thinking hat, where and when do you think that this information is passed on to the surgery? So when you are signing in to a surgery, say example, if you've relocated, you moved house, and then you're moving your surgery, which is your GP practice surgery that you go to normally from one location, and then you are going to register at the other location. So in that case, when you go to the practice nurse or maybe the person at the reception or in the administration is going to give you a form, and that form is what you'll fill in. And that form would be a patient information record form. That means the surgery is trying to get hold of information about you, your medical history, where you live, your background, your ethnicity, and then this is going to help get all the needed information that they want in order to register you with the surgery. So when you look at getting hold of information about a patient or about somebody who's new in terms of registration, even for say, for example, when you register with the dental surgery, things like that, you are going to be looking at getting hold of a questionnaire or a form, and that questionnaire or a form will need to be filled up in order to provide the basic information. And those basic sets of information is then used to populate your patient information record, and that would give the surgery and the practice background about yourself and any sort of preconditions that you have, or if you receive any medication, or if you are undergoing any treatment, or if you are having regular prescriptions, then those bit of pieces of information would be gleaned in from this PIR or patient information record. Now, there could be other sources of information which sometimes is gathered, and this other source of information could come from when you undergone an operation. Sometimes you're given in a feedback questionnaire. You normally would have nurse or healthcare assistant working with you they will always be looking at seeking information in terms of are you feeling better, or for example, is the medication helping? And in those cases, what they tend to do is basically sensitivize after taking that information. They would pass that information on to relevant people, maybe a consultant or a doctor who's done the procedure, so that they are able to then effectively tailor the care which is required for you to recover quickly from that particular patient. Now, operation. Now, when you also look at other sources of information, how would the source of information come about? Sources of information would also come about from government bodies. If I look at thinking aloud now in terms of government bodies, these bodies could be bodies which are basically bringing out new legislation. It could be bodies which are bringing out new rules and regulation which are to be implemented within the sector. these would be bodies which are bringing out guidance and advice, or implementation of these guidance and advice which needs to be done in order to provide the service. Now, some of these bodies could be regulatory bodies. Some of these advisory, which is going to come out in terms of information, is going to be advisory and is going to come out from bodies which could be charities or non-governmental bodies which are working very closely with the National Health Service and the Health and Social Care Department to be able to better and improve these services which are provided to the members of public. Now, what could be these bodies? These bodies could be, one such body that I've listed out in the slide is CQC, which is the Quality Care Commission. Now, the CQC primarily, when you look at, the Care Quality Commission is primarily a body or an independent regulator within the health and social care sector in England. And it uses inspections or uses the medium of inspections to be able to regulate, all the, bodies which are or organizations which are operating under the Department of Health and Social Care in the UK to ensure that they follow the procedures, they follow the guidelines which are laid down, and the quality standards are maintained in order to, while delivering some of these services to patients or members of the public. Now, there are other bodies like Social Care Institute of Excellence. There is a body called NICE, which is National Institute of, Care and Excellence. Now, some of these bodies essentially are non-developmental bodies. That means they're non-government, they're not owned by the government, but their aim is to bring out guidance, advice, and information services which are required for the, delivery of health and social care services to people working within this sector. So when I talk about NICE, for example, NICE is a body which is called the National Institute of Health and Care Excellence. And this body primarily looks at printing or giving out advice, releases guidelines or guidance and advice primarily for people working within this sector. So in order to ensure that people like you and me, which are working within the sector, people like health and social care assistant, healthcare professionals, nurses, practice managers, GPs, doctors, they will be releasing advice for all these different type of people to ensure that they are able to follow the guidance which is necessary for the purposes of providing effective care to the patient. Now, if I give you an example, like during the COVID pandemic, now when we look at the COVID pandemic, what was the advice and guidance issued by the government? Can anybody recall what was the advice and guidance issued by the government when we initially went into the COVID pandemic? Anybody, if they can recall some of the basic measures which the government asked us and the government bodies which asked us to do? Anybody recalls? Okay, so if we look at some of the basic guidance which was released, initially there were daily briefings which were happening by the Prime Minister, the health, the health care secretary, which was Matt Hancock at that point in time when the pandemic hit. And later on, when obviously we had the vaccines which came out, Nadeem Zahawi, who's the current chancellor, was the minister for vaccination, and he was responsible for ensuring that, people and all sets of people, vulnerable, non-vulnerable, young adults, children, all are able to get vaccinated in order to protect. And obviously there were booster doses and other things introduced. Now, when we look at, the information which was initially given out, face, space, and social distancing, some of these messaging which came out from the National Health Service, came out from the government, and there were different bodies which basically, were responsible for public messaging, which was sent out via news channels, via radio, via print material, websites, things like that, so that the government could look at curtailing the spread of the COVID-19 pandemic when we got into it in March 2020, and the lockdowns were introduced. Now, these were done by bodies which were both regulated by the government and also non-departmental bodies like NICE, as we call it, SCIE, and they were responsible for ensuring that the messaging went down to the community level and just did not remain at the top level. So these bodies are also sources of information and advice and guidelines which they issue during national emergency. So COVID pandemic declared a pandemic by the World Health Organization, and obviously all the governments and different departments within the government worked together to ensure that they could deal with this pandemic effectively. And in UK, because of the COVID pandemic, we nearly lost 160,000 individuals which succumbed, and obviously, weren't able to survive because of the fact that they contracted the COVID-19 virus. And these learnings in terms of data which has been collected will also serve as sources of information to deal with other type of pandemics in the future. So when we talk about sources of information, there could be very many at this stage, if I just briefly mention. And these sources of information could come from the once we ask the people or members of the public and officially take information through a patient information record. These sources of information can come from governmental bodies which are basically responsible for regulation of this sector, like Care Quality Commission. They could come from non-departmental government bodies which work very closely with the government, and they would provide source advice and information related to this sector. And then it will also come directly from some of the bodies which work very closely with the NHS in terms of delivery of some of these services, and they would be responsible for providing us sources of information. Now, with this in mind, let's look at some of these assessment criteria and some of the terms that we need to understand and study in terms of a bit more detail. Now, equality and diversity is something that is used when we talk about equal opportunities. Essentially, when we are talking about equality and diversity, what we want to look at is the Equality and Diversity Act of 2010. And this act, which was introduced initially by the government in 2010, basically legally protects the people from discrimination in a workplace and in a wider society with regards to when they're receiving, say, for example, treatment within the NHS. I cannot, if somebody says that I cannot deal with this patient or I would not like to deal with this patient, is basically looking at being, discriminatory, because they are looking at discriminating and not providing services to the patient on the basis of maybe culture, background, behavior, attitude, whatever it is, personality, where they come from. And that should not be a case when we talk about the principles of equality and diversity. Now, it's a legal obligation. So this is an act which has been passed in the Parliament, and this act is thoroughly implemented and integrated within the NHS National Health Service. And everybody who is basically providing or working on behalf of the government in the public sector, specifically related to the National Health Service or associated bodies, will need to make sure that they are legally obligated to protect people against discrimination. They cannot be seen to be barring them from providing service on the basis of person's sex, gender, disability, sexual orientation, religion, or maybe culture and belief, and in terms of age and disability as well. Now, when we talk about equality, if somebody is to ask you about what is equality, very clearly, very simple, you should be able to mention equal rights and treatment to all individuals. That is what it means from a point of view of implementation of this particular act within the NHS. When we talk about diversity, we mean difference from what is normal or expected. So if the person is, looking at diversity, if we are looking at the definition of diversity, what we basically mean by that is that somebody, when we talk about difference and what is the difference from normal or expected, that would be termed as diversity. Now, in other terms, if we look at, say, for example, talking about diversity a bit more in detail, what we are talking about when we talk about diversity would be looking at understanding clearly about the differences between the people and the ways in which these differences contribute to a richer, more creative and productive working environment. So sometimes you would see, when we talk about the National Health Service or NHS, we see that the culture and the people which make up the NHS are from diverse backgrounds. They are from very different backgrounds. Now, 40% of the NHS is made up of doctors, nurses, which are predominantly from outside the EU. And they have, so NHS is one such organization which is very culturally diverse. There are 55,000 nurses which work from different nationalities within the National Health Service. And when we talk about the NHS Act of diversity and equality and diversity, there is a council which is set up within the NHS, which is called the NHS Equality and Diversity Council. And this is in short called the EDC. And this works to bring people and organizations together within the NHS so that they are able to realize the vision of the NHS being culturally diverse. And there is no differentiation, no scope or no, let's say, place for any sort of differentiation which can happen on the basis of race, culture, religion, beliefs, and background. So this EDC Council basically is implemented, is something which was created in the NHS and is now endorsed by the leadership of the NHS. And again, this is a part and parcel of how the NHS provides services to its members of the public. Now, the incorporation of the LGBT Act in terms of providing health services to individuals was also added to this EDC Council's agenda and vision. So Dr. Michael Brady, he's the national advisor for LGBT in terms of providing advice for LGBT in terms of health and social care services to the NHS, and his appointment in 2019 shows the government's commitment and the wide range of stakeholders, organizations that it takes advice from and consultation from, and it tries to address any sort of health inequalities which could be vetted out towards the LGBT individuals. And this is where the integration of the LGBT health and appointment of Dr. Michael Brady as a senior advisor has happened within the NHS to ensure that there is no discrimination whatsoever. There is no room for any discrimination whatsoever on the basis of even LGBT and some of the other key aspects which are considered under diversity. So when we talk about diversity, we are looking at respecting the individual rights, irrespective of the race, culture, origin, religion, gender, sexual orientation, age, marital status they come from. And they are generally coming in from these broader areas: religion, ethnicity, disability, ability, family structure, health, if they have any underlying health conditions. So that are taken into account to be able to provide care, but that does not form any basis for any discrimination or any sort of, an example that I would give you here is what we've heard and seen and also read about is that the COVID-19 pandemic, during this time, the NHS had to put back a lot of operations and operative procedures specifically for patients which were suffering with cancer and other type of, illnesses. Now, when this was decided and put forward as a national emergency, and this was classed as a pandemic, and all the other requirements in terms of providing these treatments, they were made secondary. But now, when the treatment for these have resumed, there is no way that the NHS or the staff in the NHS or the organization or the setup in the NHS is looking at giving any priority to any particular individual. They are all going by the waiting list, and that is how the NHS looks at fairly providing the treatment to patients, one and all, irrespective of what their culture, background, religion, beliefs, and values are. And this is central and very important to understanding the second learning outcome, which talks about equality, diversity, and discrimination in relation to the person-centered approaches. Now, at this stage, hopefully you've understood the basic background about learning outcome 2. What we are discussing? So we are discussing equality, we are discussing diversity, we are discussing discrimination, and we know the definition and meaning of the terms. We know what they mean and what they refer to when we talk about equality or when we talk about diversity or discrimination, and how they are a part and parcel of the NHS or the National Health Service. And now we are going to go into discussing some of the individual assessment criteria. So any questions at this stage that you have with regards to what we've discussed so far? You can ask me if there are any questions by unmuting or by typing into the chat box. Right. So if we look at some of the so if we look at some of the basic bits in terms of some of the assessment criteria now, it talks about explain the concept of equality, diversity, and discrimination now within this context. And we know equality and diversity are different acts and legislations which are passed in the Houses of Parliament. We look at understanding how they have been, implemented in terms of, integrated into the NHS Act in particular. And then we'll also be looking at some of the legislations and key acts which are important when we talk about delivering care without being, let's say, delivering care without being discriminatory within the National Health Service and the health and social care sector in general. Now, when we look at equality, when we go back to the definition of equality, what we are looking at referring to is that everyone in the society has the same right, respect, and chances as compared to others in terms of getting the treatment from the NHS. Now, if you're looking at getting private treatment or looking at getting privately, getting some treatment done, that is something different, which will be primarily, on the basis of individuals choosing to do that. But most individuals within the UK would primarily be getting any sort of health and social care service, which is going to come from the National Health Service. And in this case, it does not differentiate on the basis of who you are, where you are from, and basic other factors that we discussed. So the treatment and the the treatment which is given out to patients would remain the same, whether you're coming in to do receive treatment for a next operation or a Y condition. Now, in terms of here in the first task, what we are looking at is basically explaining the terms equality, the definition, because it talks about explain. So we are looking at the definition of equality, we are looking at definition of diversity, and we're looking at the definition of discrimination. Now, within that, as long as you're able to describe what we've covered just as key terminology, this would end up covering, task 2.1. Now, when we talk about, especially things related to, the concepts of these three terms, what we are looking at is that as a provider, if I take an example of a care home, what we are looking at is as a provider of, say an old age home, if we take that example, and as a provider of services to people which are admitted in the old age home or care home, essentially, when we say how equality, diversity, and discrimination are done away with, these concepts can be applied at the individual level, can be applied at the organizational level, and can be applied, say, for example, at the leadership or the management level. So when we talk about the individual level, here what we are ensuring is that people do not have any mental blocks in terms of how they are going to deal with patients, and they are given adequate training to ensure that they understand the meaning and concepts of these terms, equality, diversity, and discrimination, and what does that mean in the social health and social care context. So how do you treat patients? How do you give respect? How do you respect their independence? How do you respect their privacy? What data is shared, and data protection is to be done in terms of data privacy, and what can be shared with the family member or cannot be shared with a family member. All this bit at the individual level is primarily given and made understood to the individual when they start working within the setup of the organization. And this is at the individual level. Now, when we talk at the organizational level, what we're looking at is the concepts of equality, diversity, and discrimination. The organizational level would mean that the organization has put in adequate policies in place. They are following the government legislation, which has been set out by bodies like CQC. They are ensuring that these policies and procedures are actually implemented within the organization. They are not just on paper. And there are regular checks which are done by the organization to ensure that these policies and procedures are actually working within their own setting and within their own setup. This would be the implementation of equality, diversity, and discrimination at the organizational level. Now, who is responsible for ensuring that this these policies and procedures are actually implemented and followed within the organization level. They are done by the leadership and the management of the company or the board. And how do they ensure that these policies and procedures are implemented? They ensure through the aspect of, say, for example, if we talk about a care home, somebody in the care home is going to be appointed as the registered manager. That registered practices or registered manager will essentially be responsible for ensuring all the rules and regulations as per the legislations which are required are set by the government, are actually followed in terms of the day-to-day workings of the organization. So these could mean that there is a health and safety policy, there's a data protection policy, there is a equality policy, there's a diversity policy, there's a discrimination policy, there could be a whistleblowing policy. All these quality policies which are basically going to be adapted and created within the organization from the acts and legislation which the government has put in place by the registered manager, and then ensuring that they are practiced and implemented on a day-to-day basis within the operational aspect of the organization, would be ensuring that they are following these guidelines and maintaining a diverse environment, maintaining a free environment which is free from discrimination, and it promotes equality and diversity within the workers and the setup, would be then termed as implementation of these three different aspects, important aspects of equality, diversity, and discrimination at the organizational level. So in summary, in order to ensure that providers are being fair and providing fair treatment to patients or clients who are coming in to receive treatment or receiving care, they have to ensure that the implementation of equality, diversity, and discrimination policies are done at the individual level, at the organizational level, and at the board or the leadership level, which ensures that these are followed through in the organization. So any questions on the first assessment criteria? Okay, let's go to the second one. Now, second one talks about, describe some of the legislation which are, in this particular sector relevant to equality, diversity, and discrimination. So here, what we need to be talking about is the various acts which have been, passed by the Parliament over the years, and they relate to the Equality Diversity Act, and also some of the other acts which are important and related to ensuring that the services which members, staff, employees provide to patients are absolutely looking at implementing and making it a part and parcel of their day-to-day service and operation in the context of equality, diversity, and discrimination. Now, the first thing is the Equality Act of 2010, and this act was introduced in the Parliament and then as a bill, and obviously it was passed as an act by both houses of the Parliament, and this is now known as the Equality Act of 2010, which means that we need to treat people with fairness, and any sort of let's say injustice which could be vetted out on the basis of their background, gender, sex, race, or religion would be treated as not being able to comply or meeting the Equalities Act of 2010. Now, this act also ensures that people are protected from abuse, and individuals working within this sector are required to have empathy and compassion, and also being able to respect the dignity of the individuals while working and providing services to patients which come in and receive them during the course of their maybe treatment or getting back to normal. Now, some of these acts you have to go through theoretically, because they are obviously acts, and what we need to be able to do is understand and have a built-up understanding on our side that what do they mean and what they actually help out or infer in terms of their inferences when we talk about health and social care sector. Now, the Mental Capacity Act of 2007, this act was initially introduced in 2005 and protects the individuals who are vulnerable. That means they are not able to decide what kind of care is required or needed. And if we look at the recent example of Battersea, which was in the news in the last couple of days, And obviously life support systems were switched off because the family lost the legal battle in the court, is basically related to the Mental Capacity Act of 2007. And the reason is because the individual, I think the 12 or the 13-year-old boy went into a coma and was put on ventilators, and obviously was unable to decide on the care or the treatment which is required, because the decision-making power couldn't, the individual or the boy in this case did not have any decision-making power because the boy was in coma. So in this case, the family was responsible, and obviously they were looking into dealing with the government to say that the life support systems should be continued, just because in this case so there was a battle which basically has ensued in the court. And if we see this particular battle and talk about the looking at this particular news, you will see that obviously the family lost the case, and obviously the boy actually lost his life. So when we have patients which are vulnerable and they are not able to take a decision on their care and what kind of treatment needs to be given because of various reasons, it could be like in this case they have had a brain injury, or they've gone into a coma, or they have disabilities, then in this case the Mental Capacity Act allows these decisions to be taken by near dear ones or family members, but they are subject to the fact that they cannot be used to abuse the individual's ability to be able to receive care. And that is where this particular act comes into play. Now, we also talk about the Human Rights Act under this, wherein the Human Rights Act basically looks at covering protecting the individual's fundamental rights. And these fundamental rights allow the individual to challenge any sort of decimation, which is to safeguard the individual against not receiving any treatment or any fair treatment which is required to be meted out in order for the individual to get better. And the Human Rights Acts, is under the European Convention of European Code of European Convention of Human Rights, ECHR, and it has various articles. So obviously there are lots of different articles. I think there are 12 or 13 articles under the Human Rights Act, but the UK version of this act was introduced in 1989, and this basically guarantees the right to life and protection from torture. So essentially, people who are receiving care should be given care which is given with proper personal hygiene, making sure that, say, for example, when you're receiving treatment in the hospital, the linens, the beds, and some of the other equipment which is used to provide care is absolutely clean and, is basically meeting the personal hygiene criteria when these services are provided by the National Health Service. Then we look at the Health and Social Care Act of 2010. The Health and Social Care Act of 2010 basically looks at, establishing, the equality duties essentially within the public sector, and this allows the individuals to get excellent, care, primarily when they are receiving this care because of maybe an accident or an injury, and this basically tends to be the main aim of the Health and Social Care Act of 2010. So when we look at this particular act in detail, what this allows us to do is this act works in conjunction with the Care Quality Commission, which is CQC, because they were the one which basically established and proposed this particular act in 2008. There have been further revisions into this act in 2010 and 2012. And what this primarily does is that, in summary, this act is, this act was basically, let's say, the main aim of this act was to change how NHS care is commissioned through greater involvement of clinicians and the NHS Commissioning Board. So if we look at the crux of this act, which was proposed by CQC, basically made a change in terms of how the care services are delivered within the NHS. So what they did was they basically looked at changing how NHS commissioned the care and what was the involvement of clinicians, which is doctors, GPs, consultant nurses, and their role in delivering this care to the patient. And this act also created accountability at the end of it on the side of clinicians. So if something is to go wrong, and if the operation is to go wrong, or if the operation does not result in the desired benefits which are required because of which the patient is undergoing operation, then the clinicians are responsible, and answerable for this particular, aspect of it. And that is where the inclusion of clinicians and the NHS commissioning board was done when this act was introduced. And this act also gives patient a voice in, ensuring that if they receive care and that care is not benefited or has not been given out properly, then the patient also has a voice in terms of ensuring, or maybe looking at giving feedback and going after. And that is where some of the cases that we get to see against the NHS, or when treatments don't go right, patients then are able to, under this act, let's say, provide feedback and even sue the NHS because the treatment that they received has not resulted in the benefits which were supposed to be delivered or delivered over time, and that they have not happened. So this act primarily has a lot of importance within the NHS because of the fact that the main purpose of this act in the introduction in the NHS was to empower patients by giving them a greater voice and control on their own care. And it puts clinicians in the center of, the commissioning. That means people who are providing this care become answerable, and they are answerable from an aspect that if this care is not delivered or is delivered to the set standards by CQC, then this could mean that the providers in this case could be liable for not delivering that care properly to the patients. Now, we look at the next act, which is the Care Act of 2014. This Care Act of 2014, essentially, when we talk about this particular act, it allows, when we talk about the Care Act, this basically allows people, independence. And, it makes it clear that local authorities must provide or arrange for services that help and prevent people from developing the need for care. And they should be able to support, the local councils and authorities should be able to support people when they feel that the care being delivered is deteriorating in such circumstances. And that means that they need to top up the support which is provided to individuals from time to time if they see the services deteriorating. So if I give you an example in this case, like for example, if you are an individual which is severely disabled and you receive care at home. So when you say you're receiving care at home, there is normally a healthcare professional which visits you regularly to check on you in terms of how you're doing, because you are housebound, or probably you are not able to receive care, long-term care, primarily within the hospital. So in those cases, when this level of care starts to fall below a certain described level as per CQC, local authorities should be able to provide additional services or prevent these services to from dropping below a desired quality level. And this particular act looks at doing it. So this act looks at ensuring that local authorities should and must provide and arrange for services that help people in developing and receiving the due amount of care which is required for them to obviously stay well and obviously do their basic cores and functions. So the Care Act is also important because it brings into the aspect of individuals getting the independence and ensuring that their well-being is taken care of by the authorities. So it empowers the individual, it protects them, it obviously forces the local authorities to ensure that the service levels don't fall below a certain described level as per CQC. And if these services have to be topped up, then there are, on the basis of probability and proportionality, they will, when I say they, the local authorities, local authorities would be then able to, let's say, top up some of these services or care which is needed to be provided in order to ensure that these, individuals' care does not deteriorate below a certain level and the individual remains, let's say, active and healthy. So these are some of the acts that we need to understand: the CARE Act, the Health and Social Care Act, the Human Rights Act, the Mental Capacity Act, and the Equalities Act of 2010, which are important to understand the second assessment criteria in terms of describing the legislations which help in promoting equality, diversity, and discrimination. Any questions on this? If you have, please ask me now. Is it understood? All right. Let's go to the third one, which says describe sources of information. So as we discussed in the initial beginning, when I give you a bit of an introduction in terms of how do you derive information about the patient and the services they require, and how do you collect this information? Now, it can come from different sources. So when I say different sources, what I mean by that is, how do we get hold of this information from a point of view of collecting this, which will allow health and social care professionals to deliver care which is tailored to the requirements of the individual. So when we talk about, sources of information, these sources of information can come from websites. They can come from accessing the records of the patient. There is obviously user level access defined, so that data protection and confidentiality is taken care of when these access to these records are done or is given to individual workers within the NHS or health and social care staff. And then proper following of the policies which are laid down within the organization, which allow individuals to get access to the information, because some of them could be information which they need to follow. There is information that they essentially need to, obtain, and they need to be followed because they are rules and regulations. There could be advisory and guidance. Now, these are things which organization tends to provide through newsletters, through regular memos, notice boards, your trainings, which typically tend to happen for individuals, and they tend to basically update and upgrade your source in terms of your knowledge for following some of the information which is required in maintaining, the quality of services delivered to the patient. Now, let's look at some of these sources from a point of view of going into detail. Now, policies and procedures, as I mentioned, is one such source, and obviously all employees working within the organization are expected to go through some of these policies which are created within the organization, and they need to be able to understand these policies and interpret these policies to be able to then implement on a day-to-day working within their role and within their job responsibility. Now, the second part second source that we look at is the Government's Equality Commission. Now, the Government's Equality Commission, when we talk about, basically talks about, how do we respect and ensure that the person-centered values are followed. Now, the Government Equality Commission essentially, looks at providing some clues and hints on this to us. And this basically looks at ensuring that the policies are implemented within the organization, policies related to, say, women, sexual orientation, transgender equality, and a range of, other related, say, for example, issues which are important for the employers to implement within a place of work, which is specifically health and social care. Say, for example, a care home, a nursery home, a GP surgery, a children's nursery. It could be any such place wherein individuals are getting a service or, are getting care, essentially. When I say service, what I mean by that is, because we are talking in terms of health and social care, we are looking at basically patients receiving care. And in those cases, what we need to be able to ensure is that the Government's Equalities Commission, the office essentially leads or takes the lead on making policy related to women, sexual orientation, and transgender equality. They are responsible for ensuring that a range of equality legislations are tabled. They are essentially issuing advice and guidance and how they need to be implemented within the organization. So in order, for example, let's look at an example here in terms of what the Government Equality Commission would do. Now, if I look at a particular example in terms of how they would look at, let's say, ensuring that the equality side, the care basically being delivered by a particular setup is taking into account the, let's say, the, I'm going to try and use the word, which is, in ensuring that the dissemination of information which is happening with relation to taking care of the standards which are set by CQC and also in line with the policy guidelines which have been defined by the government. So when we talk about, say, for example, the LGBT, rights and its incorporation into the NHS and the NHS, Equality and Diversity Commission, as we said, EDC. Now, this has been done to tackle disproportionately any sort of poor outcomes and experiences which individuals, which LGBT individuals might face. So the Government's Equality Commission and the role of, say, for example, Dr. Michael Brady, who is the National Health Advisor, for LGBT, individuals within the NHS, he and the body typically work to bring out guidelines and procedures to ensure that there is no disproportionate delivery of service in terms of care, which is done to individuals which, come from the LGBT background. And this is the core essence of the role of the Government Equalities Commission. So they go in and collect a lot of data on equality and diversity, and this is done through surveys from time to time. And these surveys are then, the data which is collected from these surveys is then used to bring out these advisory and guidelines in order to ensure that, there is no discrimination which is vetted out towards the LGBT community. Now, there are other sources of information, and they could be advocacy services. It could be the Citizens Advice Bureau, wherein, for example, if you are looking at, if you have had a treatment with the NHS, and you feel that the treatment has not led to led to the stated outcome. And take a specific example, you've gone in and got an operation done for your, say, for your knee surgery, and the knee surgery operation has created complications instead of solving the issue of your hard knee or your knee after the knee surgery. Now, this has created complication which is leading to bleeding and other things, and you feel that the operation which was done or the treatment which was provided was not up to the standards, and there was negligence, and obviously lots of let's say lots of different policies and procedures which was meant to be followed, they were not followed, and because of which you ended up having complications because of this operation. So this would mean that if you're looking at now being trying to sue the NHS or the practice which has given you this particular or has carried out this operation, then you might want to go to the Citizens Advice Bureau to get some advice, and that would be your primary source of information. That as a patient, what are my rights? As a patient, what can I do? As a patient, can I receive any compensation for the for the problems that I'm facing and the increased let's say increased agony that you are in, or the care that you need essentially to be able to get back to normal. This as an advice is what you can take before you decide that I want to look at filing for charges or filing for damages against the practice or the NHS trust. Then in those cases, you are going to go to the Citizen Advice Bureau to be able to get hold of more information. Now, this information, as I mentioned to you earlier, can also come from regulators, which are government bodies, non-departmental bodies, government bodies, which basically create, the say the guidelines, or the quality guidelines essentially for these services to be delivered within this sector. And they is when I say they, I mean Quality Commission is one of the main regulators and the mainstay of this particular within this sector. There's a main body, and they are an independent regulator of health and social care services within the within England, essentially. Now, their aim is to promote and ensure that all the policies and guidelines that they bring out, documentation that they bring out, it follows some and provides guidance on equality, diversity, and discrimination. And this is then adopted by different organization providers, which could be a care home, a nursery, or an old age home, and hospital. They would be looking at taking into all the advice which CQC provides on these matters, and then they will internally form their own policies and procedures, which will closely, let's say, follow and have the guidelines implemented, included, so that when they are put into practice or implemented, they are being absolutely followed. And that is where they say when a CQC does inspections, these providers are rated. When you look at the CQC inspection, these providers are rated on the basis of their quality services. And when we talk about the website, when you can go to for CQC inspection and you can look at the inspection reports, what the inspection reports clearly bring out is whether a particular setup is doing their job. Are they registering and monitoring their services to the level which is required? Are they asking and obviously looking at maintaining the standards which the CQC provides or actually says? And these 5 standards tend to be: are the services which are being provided safe? Are these services effective? Are these services or the people which are providing these services are caring? Are they responsive to the needs of the individual? And are they being, from a management and leadership perspective, being well led? From a point of view of ensuring that the governance of the setup or the organization is being done in such a way that they are providing high quality care that is based around individual needs. Now, if these 5 parameters are not being followed, safe, effective, caring, responsive, and being well led, then what tends to happen is the inspections by CQC lead to investigations, and obviously in some cases the providers can lose their license. It can lead to criminal damages. It can also mean that the services and government funding could be limited. And this report, which is the inspection report, is also a source of information, which would be useful for you as a patient if should you decide that I want to go in and look at taking, service, say for my bowel operation or for my cancer operation, and I'm going to a particular trust or a setup. Then what you would do is basically go through the CQC report as a patient to get sources of information saying that whether the setup is being run professionally, is the setup, essentially, going to be able to provide safe services. Are they responsive to my needs? And are the staff caring? And that is what would actually look at, depending on, would actually look at on the basis of these factors. You'll actually look at making a decision to say whether you'll go in and receive the service from this particular operator, or in this case, the hospital. So these tend to be the sources of information which are required to be covered in the 3rd assessment criteria. Now, let's very briefly go across into the distinction criteria, wherein it talks about assessment of the effectiveness of some of these policies and procedures when they are implemented, and how do we assess them. So here we are going to be looking at, discussing about the effectiveness of the policies which are implemented within a health and social care sector. So they tend to be, the policies which are looking at providing empowerment, looking at providing or raising the standards of care. And in those cases, whether the policies and procedures are being followed essentially by the provider in the delivery of care would need to be discussed. Now, when I say assessment, one of the things that you have to do here is we have to take a specific example and talk about the pros and cons before we come to a conclusion. And that is where you would look at, essentially completing assessment. So when we say, the word, assessment in general, there is a particular meaning, of this word. And if we look at the meaning of this word assessment, then we are going to be able to do this distinction, activity, correctly. Now, when we talk about, the meaning of the word assess, one of the things which, we need to be looking into is that we are going to give, if I put this here, we are going to look at, carefully giving consideration to all the factors that would apply in this case when the organization is looking at, providing care, but taking into account, while providing care, taking into account how it effectively implements equality, diversity, and anti-discriminatory policies in its workplace. So when we talk about the meaning of the word assess, we need to be clear about what it means and how we will go about doing the assessment. So the assessment would require us to give careful consideration to all the factors which are used to implement equality, diversity, and discrimination, anti-discriminatory practices within the organization. So things like policies and procedures, following the government legislation, acts, and regulation, they would need to be discussed when we look at assessment. Now, after that, what we need to do is basically identify which of them are important and how they are working within the organization. So here in this case, we would need to take an example, and that example will need to be specific to talk about, say, a medical center, or like when we go to a GP surgery, or you go to a pharmacy, or you go to a childcare center, then how do we see these policies and procedures, regulatory rules and regulations and acts being implemented within that setup? That would complete the process of assessment within, the context of making sure that the center or the setup is essentially following equality and diversity and promoting anti-discriminatory policies with regards to doling out or, providing these services to the patient. So here, I would then suggest that, typically you would be required to take an example specifically of an organization that you are aware of, and that would allow you to complete that process of assessment. Now, with this, obviously, we come to the discussion of Learning Outcome 2. And Learning Outcome 2, hopefully with this discussion, you have understood, how an organization looks at implementing equality, diversity, and anti-discriminatory policies within its setup to ensure that the services, in this case, the care services being delivered to the patient, are done without, any discrimination because of their age, background, culture, belief, religion, their sex, their orientation, and things like that. Now, are there any questions at this stage with regards to Learning Outcome 2? If you have any questions at this stage with regards to Learning Outcome 2, then let me know now. Let's discuss if there are any questions. Okay, what I'll also do is very briefly show you a video which will summarize what we've discussed today in terms of how equality and diversity is actually, implemented within the health and social care setup in one particular video. So let's look at and listen into this short video, which basically describes what is, equality and diversity. So let me play this now. So as you can see, this talks about, the equality and diversity that we get to see within the NHS. So I hope this bit has made it clear in terms of, how this is related to the people and professionals who are working within this particular sector, and how do they go about, they come from different backgrounds, and obviously they are a part of the NHS, and there is no discrimination, no differentiation whatsoever in terms of when they provide services, to patients, or essentially, anybody within the NHS, to all the members of the public. So I hope this video kind of sums it all in terms of how we look at, essentially looking at the implementation of health and not the implementation of equality and diversity policy as far as the NHS is concerned. So with this particular video, I would like to bring today's session to an end, and hopefully you have understood this learning outcome and the associated assessment criteria. If there are any questions, I would probably now give you an opportunity again to ask, so that we can then discuss some of these questions. If not, then what I will do is see you tomorrow, essentially in regards to covering learning outcome 3 and the meeting code for tomorrow's session. What I want to do is make sure that you guys have the meeting code today. Before we close, I'm going to try and also send you the meeting code, via text message on the WhatsApp group pretty much straight away, and that would hopefully allow you to join, the session tomorrow on time. So until then, take care. Thanks for joining, and I'll see you guys tomorrow.